So I'm here with Stephen Barabas, Dr. Stephen Barabas, sorry, at K-Laser, and I've been interested in laser and how it could potentially fit with IDD therapy.
Yeah.
And a question has often been raised about the penetration levels of laser.
Yeah.
Now, K-Laser is a class 4 laser as I understand it, and there's some differences, etc. Could I just ask you just to explain a few things for the practitioners that I know about the K-Laser and how it could potentially work within a spinal treatment, how it's used in spinal treatments? Is that okay? Cool. I'll shut up now and let you get cracking.
Well, the doctor on my name doesn't mean I'm a medical doctor, I'm a veterinary doctor. So I came from this from a scientific background where I was skeptical about whether lasers could actually penetrate deep.
Yeah.
And the reason, having been on Thor, Omega, all the different companies' training sessions, the reason why I decided to distribute this was because they actually had clinical papers showing depth of penetration.
Okay.
And so from day one, there was a raft of scientific papers showing that it wasn't just a cell culture, it was actually able to go and penetrate at depth up to about 15 centimeters with a biological effect.
Okay, so that could therefore have an effect within the spine?
Well within the spine, because the spine you're only talking about 4 or 6 centimeters.
Okay.
Whilst obviously when I'm treating an equine patient, I could be up to 25 centimeters. So the ability to be able to do that is capable on this.
Okay, so can you just show us very quickly a few of the
it is also
aspects of this?
Scientifically, it's got the clinical papers across a range of things, but also a bit like an Apple, it's very user-friendly.
Okay.
So it is calibrated
Just going to zoom in here.
to allow you to choose ecto, meso, endomorph. You can choose the area of the body, the condition that you're trying to go and treat, and then color at patient is extremely important to bypass the pigmentation in the skin.
Okay.
So that's a really important feature.
Oh, wow.
And then clinically, between yourself and your client, you choose the level of chronicity and the level of pain. So if we were going high chronicity, medium pain, you're talking about a set protocol of power, total energy, time of a short time frame, and it's based around using 4 wavelengths, which are 3 infrared and 1 for a superficial wound.
So is it like a protocol for depending on the problem?
So for this individual with a lumbar problem, it will go through 11 phases, and the pulse frequency will change, not the power, in order to treat all the different cell lines within that back structure.
So when we're treating people with disc problems, so somebody's presenting with, say, a herniated disc, they may have muscle spasm, we can't necessarily pinpoint the source of the pain, there might be lots of things going on. What is the laser primarily going to do with somebody presenting with a disc problem when we're not exactly sure what's causing the pain?
At the levels we're talking about there's a degree of analgesia. So the first and primary, there'll be analgesia, some of it localized anti-inflammatory, because the impingement of the disc will be causing some sort of pressure aspect.
Okay.
Long-term wise though, if you're using this on a chronic basis, alongside something like the
IDD.
disc distraction, the IDD, you have then the capability of using the two together so that actually the wavelengths are working biologically to enhance the healing.
So are we helping with we're helping with the reduced inflammation, which helps with the pain. We're trying to train some structures, say, with the IDD. Are there other aspects? What about the sort of the disc herniation itself?
And the photobiomodulation is using those wavelengths, but achieving it at depth to sort of start healing soft and bony structures within that area.
And what's the difference between a class 4 and a class 3 laser?
Well, for a class 3B, the maximum power they could go is 0.5 watts.
Right.
So automatically, just on this protocol, it's 24 times more potent.
Okay. Right.
In creating.
And what's potent mean?
Potent means that we are able to achieve a depth of penetration in a short time frame with a safe dose of laser therapy.
And how long so if I'm coming and I've got a disc problem or back pain, how long would you use a laser on me, or does it depend?
We work with fibromyalgia patients, and with sciatic and fibromyalgia, that might be 12 sessions.
Yes.
With someone, to be honest, who's had a disc protrusion, or someone who's had back surgery, again, that might be 12 sessions.
And how long each session? How long is actually
each
on the laser?
About 5.5 minutes, so it would tie in with doing some other modality within the clinic.
Right.
So it would work in conjunction with that.
And so you've got the I don't know what you call that.
So the actual handpiece delivers through a fiber optic the actual laser.
Right. Okay.
And then the laser is created within the module itself.
Right.
Through battery operation. So it can be battery or mains operated.
Right.
And it allows you then to go and treat a patient clinically through delivery of the laser light through the end probe.
And okay, so it's 5 minutes with the laser. What level of training does someone need or knowledge? You know, do I need a PhD in?
Yeah, but as you can see, I mean, this machine here is from a NHS hospital. Okay.
Okay.
So this is used for the plastic hand unit on chronic regional pain syndromes, where we're using it centrally and locally to reduce that chronic pain.
Okay.
In the case of the training we do there, we do in private practice as well. So it's called the Core of Knowledge.
Okay.
And it's a half-day training.
Okay, so it's not long.
Half-day training, but then 3 modular courses that we set you, along with an examination online.
Okay. So, and how long are those courses? So how long are they?
Honestly, they're about an hour each. So,
okay. So it's not.
So the actual online courses are relatively simple and quick.
Okay. Okay. I can't think of any more questions right now, but that gives us a good sort of intro. Is there anything else you want to say?
I think the ability of being able to, one, have a laser that clinically is proven to penetrate at depth, but also we have neuropathic pain studies, we have bone studies, we have soft tissue studies, so we've got a range of studies to go and prove the efficacy, but also the ability to have such a portable machine that can fit into any size clinic.
I've got a question. So sometimes people are concerned about safety and I don't know, wearing goggles or